A very good evening, Zimbabwe. You are listening to Studio 7 from the Voice of America in Maryland. This is Gibbs Dube.
And I'm Marvelous Mhlanganya Huye. This Friday, May the 22nd, broadcasting from my home in Washington, D.C. due to the coronavirus pandemic, which is currently ravaging the whole world, including Zimbabwe, where we currently have 51 confirmed cases, 4 deaths, and 18 recoveries. What does it look like worldwide, Gibbs?
So, as we are speaking right now, Marvelous, we know that there are many people in the world that have actually contracted coronavirus COVID-19. And when you look at the figures, they are really shocking. We've got 5,127,125 people who have actually contracted coronavirus COVID-19. And then out of these people, about 333,398 have actually died. And we must emphasize that there are recoveries as well. And some people that have recovered are almost 2 million. So they are 1,964,622. This, according to Johns Hopkins University and the Voice of America. And then when you look at America itself, it's sort of like also shocking, because there are almost 1.5 million people. There are over actually 1.5 million people that have contracted coronavirus COVID-19. And out of these people, 94,729 have died. So it seems as if, the curve is still going up. And I think some doctors that we're going to have today are going to explain some of these things. And as Marvelous stated, there are 51 people in Zimbabwe who have contracted COVID-19, 18 recoveries, 4 deaths, and 34,707 people that have been tested. Yes, Rwanda basiyabona ukuthi kulabantu abaningi sibili asebebanjwe umkhuhlane lo we-coronavirus COVID-19. So siyabona sebesedlula-ke izigidi ezinhlanu 5.1 million asebebanjwe umkhuhlane lo. Kuthi asebebhubhile bayadlula i-334 asebebulewe umkhuhlane lo emazweni wonke jikelele. Nxa sikhangela-ke kwelemelika 1.6 million asebebanjwe umkhuhlane lo, kube sokusithi-ke abedlula i-94,000 sebebhubhile. Nxa sikhangela njalo-ke sijula kwele Zimbabwe siyakwazi bayi-51 kuzobuya-ke i-51 laba yibo asebebanjwe umkhuhlane lo, kuzobuya abayi-18 seberecoverile, kuzobuya-ke abayi-4 sebabhubha, 34,707 asebemane bathi-ke bahlolwe umkhuhlane lo. Kunjalo-ke Marvelous.
Aiwa, kunavo vachangobva kupinda muchirongwa tinokuchingamidzai nemufaro. Ini tiri kutefenyura ndiri kuno kumba kwangu kuWashington DC pamusoro pedambudziko rechirwere cheCovid-19 kana kuti coronavirus icho chatekeshera pasi rose. Pari zvino munyika tinoona kuti mune vanhu 51 vakawanikwa ivo vachibatwa nedambudziko irori rechirwere checoronavirus vari kunzi ivo vakatesta positive. Zvinoreva zvakare kuti aiwa pane dzimwewo nhau dzatiri kutambira dzekuti pane vanhu 18 vakabatwa nechirwere ichi vakakwanisa kuchikunda, asi zvakare kune vanhu 4 kana kuti 4 vakabatwa nechirwere ichi vakawanikwa ivo vachishaya. Saka ndo zvatiri kutarisa ipo pano kuti zvakamira sei pasi rose panyaya yedambudziko rechirwere ichochi cheCovid-19 kana kuti coronavirus. Tinoona kuti pari zvino kune mazwi kana kuti zvatiri kubva kutambira kuJohns Hopkins University iri muno muAmerica iri kuti iyo pasi rose pane vanhu 5.1 million vabatwa nechirwere checoronavirus, 332,000 zvichidaudzira vachiwanikwa vachishaya. Imo muno muAmerica mandiri pari zvino kune 1.5 million vanhu vabatwa nechirwere ichi, 94,000 vachishaya. MuWashington DC muguta randirogara imo munova mucapital mune vanhu 7,788 vabatwa nechirwere ichi, 412 vachiwanikwa ivo vachishaya kubva kuchirwere ichi. Saka ndo zvatiri kukurukura ipo pano. Takatarisa kuti munyika pari zvino mutungamiri wenyika vaEmerson Mnangagwa vakazivisa ivo kuti nyika ichange yakavharwa indefinitely, zvinoreva kuti hazvisi kuzikanwa kuti ichazovhurwa rini, asi vachange vachitarisa bi-weekly, zvinoreva kuti panopera 2 weeks pese vanenge vava kutarisa kuti vovhura nyika here kana kuti kwete. Saka pari zvino nyika yakavharwa, uyezve vazhinji pari zvino vari kuchema ivo nyaya yenzara. Vari kuchema kuti nzara ndo iri kunyanyonetsa. tichitarisa kuti vanoita mabasa ekuchengeta mimigwagwa pari zvino havasati vaakubvumidzwa kuita mabasa aya. Uyezve tiri kuona pari zvino kuti vamwewo vanoita mabasa vari kubvumidzwa zvavo kuenda kunoita mabasa iwaya, asi vanofanira kunge vaine tsamba, uyezve vachiita iyo inonzi social distancing, vachitesta vanhu vanonge vari kuuya pamabasa ipapa kuti matemburicha avo akamira sei, vakapfeka mamaski kuitira kuti vasawanike vachitapura chirwere ichi kana kuzadzawo vamwe kana vainacho. Gibbs.
Yes, marvelous. We'll start our program with, the Permanent Secretary of Education, Tumisang Tabela. She actually issued a statement, in Parliament. She was appearing before a Parliamentary Education Committee on what is going to happen in Zimbabwe in terms of, preparations for examinations. So I think we've got a video of her saying that the schools will open in a phased way. But let's listen to what she will try to say about this issue.
We have consulted, we have been given feedback. So currently we have taken from the feedback that we have received, we have suggested how we are going to maybe phase the opening of our schools. But the actual dates, we are meeting our teacher unions this afternoon, and we can't reach a date without them because they are our own politicians. The minister also has to take whatever suggestions will come after this afternoon to cabinet tomorrow, and after that maybe then we can be given particular tentative dates. But for now we are envisaging 5 phases of how to go back to school. Phase 1, we were looking at examination classes for 2020. That is grade 7 in the primary school, O-level and A-level classes in the secondary school. So when these finally open, we also are convinced that for us to be able to open, we need at least 4 weeks for logistical issues. We have to come up with budgets. We have sent some of our budgets, but we still really need a minimum of 4 weeks to be able to say, yes, we can walk into the schools. We've trained our teachers. We have trained our heads. We have trained our whole system. We have got the PPEs. We've got the thermometers. We've got whatever. And we are ready to walk into a school. But in terms of actually getting even the funding, that's why we need time, because it's a process, it's not an event. Then what we are looking at in terms of what exactly do we require for returning to school, we just picked a few key issues or key things that we thought might be necessary for us to say we are ready to go to school. We need a clean water source within each school, but unfortunately currently we cannot guarantee that in all our schools, because quite a number of our schools don't have any source of clean water. So that's another resource that needs to be looked at, or infrastructure that needs to be looked at. We need hand washing soap or detergents, and in our case we are looking for liquid, because solid handling becomes a danger in terms of the solid ones. We are looking for hand washing stations where, as much as possible, our learners will not use their hands to turn a tap on or whatever. We are looking for where people can afford it, sanitizers, especially for urbanites where there's huge populations. We think they might have to think of sanitizers. As we plan, we are hoping that by the time we say phase 1 should start, our schools will have been freed. But if they are not free, it means we have to have children learning in exile in other schools as we wait for their schools to be finally sorted out. We hope that won't happen, but we're just saying, in case the country situation is such that some schools still have to be used, we also have to plan now in the early phases to have children combining and learning at different schools from what they normally use. And in some of our schools, there is need for refurbishment, because some of the walls are such that your little viruses can find very friendly places. I think the details, if they are wanted, can then be given. So, Honorable, I think those for me were the two key areas which I thought I would talk about, the two pillars of going back to school and then continuing with alternative provisions for learning. But teacher capacity, as I'm saying, is important through and through.
So there you are, Marvelous. I think Mrs. Tumisang Tabela is very clear about what is supposed to be done by the government. Okunye njalo ke akutshengisileyo khonapha Marvelous ukuthi sebe lama PPEs, sebe lama thermometers, sebedinga ke funding yokuthi abantwana babuyele esikolo. Kodwa ke uthi hayi lokho ngani kusahlupha ngoba imali abakayitholi. Okunye njalo uthi kumele babe lamanzi, amanzi okugeza izandla, amanzi ukuthi make sure ukuthi akula muntu olimelayo. Njalo bedinge ama-hand sanitizers lamasepa okumele asetshenziswe. So uphinde wakhuluma njalo lokuthi abanye abantwana abalezikolo ezingana zikalungi babe befunda kwezinye izikolo ubizwe wathi i-exile, ukuthi babe behambe besiyafunda somewhere else kula lapho okumele befunde khona. Then wasesithi-ke okuhluphayo ukuthi ezinye izikolo imiduli ibhobokile, so imiduli iyaqeqebuka, like there are holes emdulini kuma-holes. So uthi imholo naleyo yiyo engenza ukuthi-ke kugcine ivirus ibamba nkikho lapho. So kunjalo Marvelous, qhubeka khona.
Aiwa, apho tanga tiri kunzwa kubva kune primary and secondary education permanent secretary Tumisang Tabela vanga vari kutaura ivo zvinokwanisa kunge zviri kuitwa kuti vanhu vakwanise kunge vachizodzokera kuzvikoro kana kuye kwatingati kuti vana vaende kunodzidza zvakare. Tiri kuona kuti vanga vari kutarisa kuti pari kudiwa mari mabhiriyoni emadhola akati one day kuitira kuti vana vakwanise kuenda kunodzokera kuzvikoro. Uyezve vachiti ivo nyaya iri kunyanyonetsa nyaya yekuti maPPE kana kuti zvinoshandiswa zvakadai semamaski zviripo here, uyezve kuti pane mvura here kuti vana vawanikwe vachigeza maoko, pane sipo here yekushandisa nezvimwe zvakadai. Saka ndo zvimwe zvavanga vari kutaura nazvo ipo pano, vachitaura panyaya yekuti vana vawanikwe ivo vachidzokera kuzvikoro. Takaona zvakare vadare vachitaura zvakare muparamende, tikaona honorable kana kuti vatingati senator Priscilla Misairambwi mushonga vachitaurawo pamusoro penyaya iyoyi kuti pane zvavari kuzeya panyaya yekuti kuchanyorwa here maexams, vana vanganyoresa sei nezvimwe zvakadaro panyaya iyoyi yatiri kutarisa panguva yecoronavirus kana kuti COVID-19 pari zvino, dambudziko iri ratekeshera pasi rose, apo munyika pari zvino tiri kuona kuti muine 51 cases dzakatesta positive. Toona zvakare kuti mune vanhu vana vakashaya, uyezve pari zvino pane vanhu 18 vakawanikwa ivo vachibatwa nechirwere ichi vachikwanisa kuchikunda. Saka tichange tichizeya zvakasiyana siyana ipo pano. Tine vanyarikani vedu, tina vana chiremba, uyezve nezvimwe zvizvarwa zveZimbabwe zviri muno zvatichange tiri kuzeya navo tichiona kuti zvakamira sei panyaya yedambudziko irori recoronavirus. Dibs.
And our first guest is Dr. Atmo Chokwiro. He is a doctor based in Atlanta, Georgia, here in USA. You can pose the first question, Marvelous, then I'll bring him on board.
My first question would be, we're seeing that Zimbabwe's cases are rising. What does this signify, looking at the situation we saw here in the USA?
Dr. Chokwiro, I guess you got the question, and welcome to the program. So she's saying numbers are rising in Zim, and so people are worried. What's your reaction to that?
Well, I think this is certainly a cause of concern, what we have seen happening in the last week or two, especially in the last week, where we have now seen the cases rising. I think you agree that for some time, we had our cases kind of stuck at 34, and suddenly we are seeing some kind of acceleration of these cases from 34 to 51 now. But what is important to read into these figures is why this is happening now. If you are following that, these are cases that have come from South Africa, from Zambia, and from Botswana, and I think only one or two people who don't have any history of travel. But if you also closely watch what is happening in South Africa, there's also been another huge acceleration of cases in South Africa. And South Africa now is topping the list in terms of the number of cases in Africa. As of last night, I think South Africa was at 19,200 cases. So we have seen a number of Zimbabweans coming from South Africa in the last 2 weeks as well, and from Botswana and from other countries. And so this is a concern in this that we could also having a kind of like a feed on from those increases which are happening in the neighboring country of South Africa. And I think that is why we must be really concerned and try and make sure that the issues to do with quarantine, the issues to do with washing our hands, preventive measures and face masks are really adhered to, because if we don't do that, you see the way that the coronavirus spreads, it's a function of the number of active cases that you have. This is a highly contagious infection. So if you have one infection, sorry, if you have one active case, they can only meet as much, I mean, people say 10 people, I mean, per day. I'm just giving you an arbitrary example. Compared to having 100 active cases, if 100 active cases each meet 10 people per day, in getting into contact with, say, 1,000 people, I mean 100 times 10. But if you are having only one active case and they are meeting 10 per day, you are only having contact with 10 people. So if we have, say, 1,000 cases in Zimbabwe, our potential to have these 1,000 cases multiplying to become 20,000 becomes much faster. So if we keep our cases lower, we contain this pandemic. So we really need, I mean, this is what is happening in South Africa now. They now have a lot of active cases. So the rise in cases also, the acceleration increases. So this is why we must be concerned about this latest rise in our cases. But I think it must be understood in the context of where these cases are coming from. It's unavoidable. I mean, there's no way we can close our borders to our returning residents. Zimbabwe is their home. And but I think we need to be really strong in terms of our preventive measures.
So some people are linking the increases in terms of numbers to the cold winter season. You know, is there any link between the two?
Well, I think as with any flu virus, I mean, winters have all been the peak season where we experience these increases in terms of flu infections and everything else. But I think it's important to understand that even before the flu season, we were already having this coronavirus pandemic. Is increasing in other countries and everything else. So I want to interpret this rise within the context of this where the cases are coming from, because I think the ministry is tracking in terms of returnees and everything else. So what the winter season may do is it may then create an environment where the acceleration can become higher in terms of once we have active cases within Zimbabwe. But I would not want to say it is the winter season per se, which is, I mean, causing the rise. This is, I mean, a contagious infection where you need contact with someone who is infected for you to be able to get it in the first place.
Well done there, Doctor. Let me bring in Marvelous. Go ahead, Marvelous.
Tombobvunza Dr. nerurimi rwamai kuti tinoona kuti uwandu hwevanhu huri kukwira muZimbabwe pari zvino tine 51 cases, uyezve tichitarisa kuti mutungamiri wenyika vaEmmerson Mnangagwa vakazivisa ivo kuti vachange vari kutarisa bi-weekly kuti vovhura nyika here kana kuti kwete. Munoona zvakamira sei pari zvino? Nyika ingavhurwa here kana kuti vomboramba vakadzvanya ipapo pavari?
I think zvakakosha Marvelous kuti ticherechedze kuti kuwedzera kwaita macases in Zimbabwe in the last 2 weeks or masvondo maviri apfuura, especially week ratiri rino iri, zviri kukonzerwa nei? Macases aya ari kubva kopi? Macases aya ari kuenda kopi? Taakuona kuti zvizvarwa zveZimbabwe zviri kudzoka munyika kubva kuSouth Africa, kubva kuBotswana, kubva kuZambia, kuti vanhu vanenge vachidzoka kumba kwavo. Macases aripotwa in the last week kana kuti musvondo rapfuura, mazhinji acho macases evanhu vari kubva kunze kwenyika vachidzoka muZimbabwe. hatingarambidzi vana vezimbabwe kuti vadzoke munyika mavo, ndokumba. So that is important. Asi toda kuti ticherechedze kuti kana vanhu vachinge vadzoka tiri kukwanisa here kuteedza mitemo kana kuti nzira dzinoita kuti mainfection asawedzere munyika, zvinova zvequarantine, social distancing, kupfeka mamask, kugeza maoko. So hongu tiri kutevedza zviri kutaurwa kuti every 2 weeks panenge pachizotariswa kuti zviri kufamba maererano nekuti nyika ichivhurwa here nechii. The issue of our economy, mararamiro edu muZimbabwe, munoziva kuti vazhinji vanhu vari kuzviriritira kuzvishandira kuti vawane chikafu, vachitengesa zvinhu, vachirima nekuita sei. So kuti nyika irambe yakavharwa, vanhu vasiri kukwanisa kuzvita mabasa, tichaita mamwe matambudziko zvakare ekuti vanhu vanokwanisa kufa nenzara, vanhu vanokwanisa kutanga kuita criminal activities kuti vakwanise kurarama. So zvinhu zvinoda kuti zviiswe pamwe chete. Chandingada kukurudzira ndechekuti tinoda kuti nyika yedu ikwanise kuvhura as soon as possible, kana kuti panenge pakwanisika kuti nyika ikwanise kuvhura. Asi ichinge yakavhura kudaro, ngatingei tiine nzira dzinokwanisa kuti mainfection asawedzere. Vanhu vari kubva kunze kwenyika vachidzoka, nyaya dze-isolation nequarantine dzinofanira kupfuurira mberi, nyaya dzekushandisa mamask dzinofanira kupfuurira mberi, nyaya dzekugeza maoko dzinofanira kupfuurira mberi. Vanokwanisa kuti minimize kufamba, kutravela, zvakakosha zvakare kuti zviitwe izvozvo. Mainstitutions akaita semakuru, akaita mauniversities, maschools, I think it is important, zvakakosha kuti tinatsoita tara titange taita our environment safe. I think there are some voices vanhu vari kukurukura vachipa mazano iwayo kuti ngatitange tanatsoona kuti muzvikoro, kumauniversity nechi takwanisa here kusvika chinhanho chekuti tingazoti vana ngavadzoke. Ndinofunga kuti kuti tirambe ikonomi takavhara, that will not be sustainable as well. We have to be honest with ourselves. Even kuno kuAmerica, I think muri kuzviona zvichitaurwa vanhu vachiita maprotest nekuti munhu kuti ararame anofanira kunge achishanda, achifamba, achizviriritira. And kuma-developing countries akaita senyika Zimbabwe, it's even more important kuti vanhu vakwanise kuzviriritira.
Thank you so much, Doctor. Let me bring back Marvelous Mhlanganya. Go ahead, Marvelous.
Ndichiri ipapa pana Doctor, maybe imboti remind us again kuti zvakakosha sei kuti vanhu varambe vachiteedzera zvamuri kukurudzira kuti pfekai mamaski, musabate mhino, musabate maziso, musabate muromo, social distancing. Zvakakosha sei? Corona virus inotapuriranwa sei? Uyezve ungaziva sei kuti unayo?
Go ahead, Doctor. Maybe start in English, then you finish in Shona, very briefly.
So the coronavirus symptoms-wise, headache, fever, and also a dry cough. But sometimes you can even just have a cough which is wet. My symptoms, these symptoms usually appear 4 to 15 days after infection. The incubation period is now known to last about 4 to 15 days. Once waitama symptoms like in this current season, it's important for you to get tested for a confirmatory test to say do you have the coronavirus or not. There are rapid tests available which can quickly detect within 15 minutes, but these are screening tests. They are not entirely specific or sensitive. So you still need a confirmatory test, which is a PCR test. Currently in Zimbabwe, these PCR tests are done in Harare and Bulawayo only. I was reading recently, I think Chinoy as well is doing GeneXpert. So there could be some other facilities which are now doing PCR tests to confirm, but that will now take, a longer time for you to get that confirmatory test if say you are outside Harare, because your sample needs to be transported rather to that testing site. Why it's important for us to observe social distancing, for us to wash our hands, it's because the coronavirus is spread by contact. So once I touch a surface where the virus has been shed and I then touch my mouth or my nose or my eyes, I am enabling entry of the virus into my body. So it's important that I do not touch those mucous membranes. Suppose I've touched some surface which was infected. Using a mask prevents me from spreading the virus to someone. Suppose I'm infected. If I cough or I sneeze, my droplets will go on the cloth or on the mask, and they will not go on a surface, or they will not go into someone else's mouth, eyes, or nose. So a mask protects me from spreading the infection. But there are also other medical masks like the N95 or surgical masks. Those masks also enable prevention, like me from contracting the infection from someone. But these masks are not easily available, and they've been reserved for healthcare workers primarily. So the cloth masks that everyone else is being urged to wear is primarily to protect someone from not spreading the infection. I think this is important that we know that these are very effective methods in terms of preventing spread. In Shona, ndingangoda kuti ma-symptoms infection ma-symptoms anorada coronavirus ndeyekuti ukakosora chikosoro chiri dry, kana kuti musoro kutema, kana kuti kunzwa mwiri kusa, unogonawo kunzwa kuneta nezvi. Asi 3 ma-symptoms iwaya ndo ari very common muchirwere checoronavirus. Chinowanzobuda mazuva 4 to 15 mushure mekunge waita infection. Zvakakosha kuti ticherechedze kuti chirwere checoronavirus chinospreada kana ndichinge ndafema mhepo ine infection yecoronavirus, kana ndiri very close, kana kuti ndiri padyo pedyo nemunhu ane infection yecoronavirus iyi. Ndosaka vanhu vari kunzi garai mudzimba, so that unoavoida kusangana nemunhu anenge ane infection. Vanhu vari kunzi vapfeke mamask, nekuti mamask anochengetedza here ndikakosora kana kuti ndikahotsira, zvandinenge ndabuditsa mwiri mangu hazvichaenda kune vamwe vanhu, hazvichaenda pamasurfaces. So zvinochengetedza anenge asina chirwere. Saka mask inofanira kupfekwa nemunhu wese. Kunewo mamask anoita kuti usabatire chirwere. Mamask aya ma-medical mask anonzi N95 kana surgical mask. Ende mamask aya ari kunyanya kuchengetedzerwa vanoshanda veutano nekuti anodhura. Asi mask chero yecloth yejira ngatiishandisei, nekuti inochengetedza vanhu vakawanda kuti kana ini ndine infection handichaitapurira kuenda kune vamwe vanhu. Kugeza maoko kwakakosha, kuti kana ndabuda panze, kana ndakwazisana nemunhu, ofu chikukwazisana hatisi kukurudzira zvakare. Asi suppose zvaitika raundi ndabata surface ine chirwere checoronavirus, ndikazobata muromo, ndikabata mhuno, ndikabata maziso, ndakuita kuti infection ipinde mumwiri mangu. Saka kakosha kuti ngatigezei maoko kana tichinge tabva kunze kwatinenge tabva. Asi ngatiedzei kuti timinimize contact nevamwe vanhu, tichiita social distancing, ngatiminimize unless it's necessary, nekuti ndo kuti tikwanise kuzvichengetedza kana tichine ma-active infections akawanda sanga zviri kuitika currently.
Thank you very much, Doctor, and stay on the line. I think we've got another guest that is in Bulawayo. His name is Mr. Fundani Ndimande. He's on the line right now, so we're trying to call him on the line. I think he's waiting for a call, and he's living in a place called Lopengula West, that is in Bulawayo, the city of kings and queens. So let's hear whether he's going to respond to our call, but I'm sure that he has now responded to the call. Mr. Ndimande, good evening and welcome to the program.
Yebo.
Yeah, unjani khona ngapho koBulawayo?
Hayi koBulawayo right kakhulu. Kunjani ngakuwe ngapho kwelemeli?
Hayi siyaphila sibili, sondele efonini yakho ukuthi sikuzwe mnandi. Otherwise siyakuzwa sibili. So ke akusitshela ukuthi siyabona ama figures lokho ngani ayakhuphuka eZimbabwe. Abantu bathini ngalokho?
Abantu mbone ngani bayezwa sibili emsakazweni khona ngapho lamphephandabeni ukuthi hayi inani ngani liyakhuphuka, kodwa sebekhathele abantu. Kunini ababoni mzamo ngoba lapho emalokitshini iproblem ekhona, amapholisa angikhona i-lockdown yangikhona ngani ngiyokuvalela ukuthi ungangeni idolobheni. Lapho emalokitshini ababonakali ngoba i-lockdown kumele ihambe lento zonke. Uma bevala le-stand begwapa amask emathawuni lapho ovule khona, sifuna ukubona le malokitshini kusenzakala ukuthi emalokitshini abantu beqhuke futhi amamask. Bona i-lockdown yangikhona kumele implement yonke indawo ukuze kusebenze.
So okwamanje abantu abagqoka ama-mask bakhona abanye abazihambela nje.
Emalokitshini nje bakutshaye indiva lokho kuyindaba bahambela nje mahlayana abagqoki ama-mask. Mbona ngani nje vele ngani sebekhathile lo mkhuba okungani basondelana, social distancing, ngani hayi abasayinazo kakhulu.
Kuyini okwenza ukuthi kube njalo?
Mbone ngani khona sebebona ukuthi amazwe ase-easy lockdown nalapha i-government ama-figures awaphayo athembakalanga. Lakhona ukuthi bona abantu nje bona babhilive ukuthi abakaboni umuntu olalo leli gciwane, as long as belizivela khatshana le, hayi babone ngani lapha vela libo. Mbona ngani babona ngani.
Pho manje abantu awusize belimale ngakhonokho babantu bantu?
Mbona ngani kungenzeka sibili ukuthi belimale, kodwa i-government nje ile problem yokuthi kumele ibalance between the two. Ngapha kumele ivule i-economy, ngapha kumele ivikele ama-citizens. Ngapha sile problem futhi kwezoma-economy ngoba abantu as long as kuvaliwe so ama-industry lani abala ndleko, abala mali zokuthi bekwanise uku-afford izinto. Ama-industry sebegcina besenza lokhu okuthiwa i-hoarding, izinto befihla, ugcine kuzaba ne-shortage nje ukuthi sibe le-crisis kwezombusazwe la.
Yes, can you hold on there? Marvelous, what Mr. Ndimande is saying is that, you know, these figures are actually shocking because people are now relaxed. They are hearing that there is some kind of relaxation of these lockdowns in other parts of the world. So people are just doing what they want. Now, he's saying that some are no longer wearing masks and they haven't seen somebody who is suffering from this disease. So they are so relaxed that anything can happen. And they say it's really scary because the way it is going, the Zimbabweans may find themselves in very, very, very serious trouble.
Yes, Gibbs, I think that's really the sentiment of a lot of people that I've been speaking to. I just finished doing Let's Talk Ngati Kurukure. And people were saying exactly that they don't know anybody who they can say someone from that house or that village suffered from coronavirus and actually passed away. I think, you know, people were a little bit jilted or saw the face of coronavirus on one of the patients, Zuroro Makamba. At that point, people really did take heed and started panicking and started observing social distancing. But from then on, they've just gone back to relaxing again, like what the caller there is saying. So it's sentiment that we've been hearing coming from the ground that maybe the message needs to be intensified. The awareness programs need to be really heightened for people to understand that you may not know somebody who suffered from this, but it's definitely there. You know that here in the US, even going to the shop is scary. I've been at home for a week. I've not even ventured out because I'm like, I'm safer here. I'm isolated. I'm by myself. I'm okay. I'm used to it because I know the effect that it has and just how it can take someone's life just like that.
And I guess the situation, Babandimande Kobulawayo, is worsened by the fact that, you know, water supplies are very, very dicey. So tell us a bit about that problem, you know, the water crisis vis-a-vis the coronavirus COVID-19. Are you still there, Ndimande?
Yes, I'm still there.
Yeah, so akusitshele ngakhonokho ukuthi amanzi awakho kuzobuya ke abantu bathi gezani izandla, amanzi pholi wathatha ngaphi njalo kwethusa kanganani konke lokho?
Alright, ngifuna ngesilungu nje ngesintu.
Qalisa ngesilungu bese ugqithisa ngesindebele.
Alright, yeah, the situation I think is quite appalling because on one end you have a water crisis due to low dam levels, as the Power State Council always tells us. But on the other hand, people have to wash their hands properly so as to protect themselves against this COVID-19 pandemic, of which is a problem there. The situation is not balancing because there's no water on one end. So what can our people do? sengithanda ngesintu lapha gift
qhubeka baba.
Thilo siyabona imizamo uhulumende usitshela ngokuthi ngale enyamendlovu sebe-speeda up ama-dam level, kodwa mina ngithi that is not good enough ngoba esikudingayo la esidingayo i-situation ukuthi uhambe fast njengoba ambona ukuthi angakuphathisa i-situation lesifuna isolveke kathesi. Asifuna ama-baby steps lawa athathayo, sifuna ngani bengaphangisa zibili ukuthi sikhuluma kathesi kumele ngasikhuluma ukuthi amanzi asekhona.
Siyabonga kakhulu baba Ndimande, sicela ubambe khonapho. Marvelous, we've got our third guest, and that is Mrs. Lucy Nongwe Chikowero. So welcome to the program, madam, and we believe that you are okay in Wisconsin. So how is Wisconsin today?
Thank you. We are fine. As you know that our safe-at-home orders by the governor were overturned by the Supreme Court. People are starting to venture out, but with most of the people, they are looking at what's good for them. So they are still staying indoors, but obviously there are those who think that they were being oppressed and their rights were being oppressed and they want to go out.
So I think I'll bring in Marvelous so that you can talk to her about some of these issues. Just hold on 1 second so that Marvelous can come on board. Marvelous, maybe you've got a question for her.
Hey, I see Miss Chikowero there, but I don't see her anymore. But I think I could hear what
go ahead. She's there. Talking
about the stay-at-home orders where she's from in Wisconsin. Saka ndinoshuvira kuti vakadzoka tibva tazovabvunza kuti kwakamira sei
kwavari. No, in fact, Marvelous, she's there. She's there. Go ahead. Pose a question for her. She's around. Go ahead. So I think Marvelous is not hearing us, but Chikowero, so she wants you maybe to respond in Shona, about what you are facing there.
Okay, kuno ku Wisconsin kwandiri tiri kuona kuti uwandu hwevanhu vari kubatwa nechirwere checorona huri kukwira kubva musi wakaitwa over 10 by the Supreme Court yeWisconsin. Stay at home order yakanga yaiswa nagovernor. Nyangwe zvazvo tinoona kuti pane vanhu vazhinji vanotarisa zvakavanakira, saka vari kugara mudzimba. Initial order yakanga yanzi ichasvika musi wa26 May. Saka vanhu vari kuti ngatimbopfuurira mberi tichiona kuti kusvika musi wa26 kwacho kuchadii. But kune vamwewo vakanga vachinzwa kuti kodzero dzavo dzambunyikidzwa, saka ndivavo vagara vari kubuda. Saka panonge pachiti netsei, sezvo panoda kutsvagwa balance between kodzero dzevanhu nekuchengetedza utano.
So Marvelous, I think maybe you are hearing her. She's talking about the system there in Wisconsin. Go ahead, Marvelous.
Yes, I heard what Ms. Chikowero there was saying. She's saying that there should be a balance. Saka ndoenderera mberi nchiti tombotarisa zviri kuitika kuZimbabwe pari zvino. Imi munozviona sei muchienzanisawo zvamuri kuona zviri kuitika ikoko kuWisconsin panyaya yedambudziko irori recoronavirus. So I'm just asking, how can she compare the two, Zimbabwe and where she's at?
Okay, let's bring just go ahead, madam.
Ndinoona sekuti kuZimbabwe hongu vanhu vakadzidziswa nenyaya dzechirwere, but havasi kunyatsoona ndingati the real effect yazvo chaizvo. Sezvo sekufunga kwangu ndinofunga kuti manumbers ari kunyatsobuda haana kunyatsoti tsvikiti zvekuti vanhu vangavhunduka kuti ndikabuda ndinonosangana nacho. Zvinobva zvakonzera kuti tikatarisa, for example, vanhu vachibva kumabasa unoona vakaita kuungana vachimirira mazupko nevamwe vasiri kuobserva social distancing zvakanaka. saka ndiri kuona sekuti pamwe kubudiswa kwemashoko neuturu hwechirwere uhu hausi kunyatsoemphasizwa zvakanaka. And also pakuti vamwe vanhu vari kungozoshaya asi pasina kutaurwa kunzi vanga vazotestwa here. Ndiri kuona sekuti dai zvaibvira hurumende yedu yaita step up panyaya dzetesting kuti vanhu vanyatsoziva patimire chaipo, nekuti ndo zvandinoona kunge dambudziko guru iroro. Kunoku kwandiri vanhu vanonyatsoziva kuti chirwere ichi chakamira chakadai, mabatiro acho ndinochidai, ende vanhu vakabuda zveshuwa voona kuti uwandu hwevanhu hwatokura naye, saka vanhu vanobva vatanga kudzokera vachifunga mafambiro avo kana maitiro avo kuti vanobva vazvishandura.
Siyamuzwa kukhuluma lapha ke Marvelous wothi ke sizwe ukuthi ubaba uNdimande ngabe sithini singakayi kuye siqale siye kudokotela. Baba Ndimande sicela ukuthi ungabe ubhodabhoda khonapho nxa uhamba hamba siyakuzwa, so ube one ndawo kwezethi kungabe lomsindo. So Marvelous, maybe let's go back to our doctor, and that is Dr. Chukwiro.
Yes, I just heard there from our sister there out in Wisconsin. Very interesting indeed, comparing the two scenarios, Zimbabwe and here in the United States, where when you go out, you're actually afraid of people more than anything else, because we know this virus is transmitted through contact. So I don't know if the doctor is still there.
Yes, is there. Yes, quiet.
If we can, if I can just pose a question to him, because I know he's actually here on a study tour, but he's from Nyanga, down there in Nyanga in the rural areas. What message are people in the rural areas actually receiving right now regarding this COVID-19 from what he's hearing from his colleagues in Nyanga? Is the message getting there?
Yes, okay. Let me bring the doctor onto the show. Doctor, you can react to what Marvelous is saying there. Quiet, sir.
Yeah, so the message is there. I was speaking to Dr. Mbata, I think about 2 hours ago, the district medical officer Nyanga, and also Metron Toma a short while ago, and even some of my colleagues at Mount Melary Hospital. So the message is there, but I think what is worrying is what my fellow countrymen are actually talking about, to say that there is a risk that because we have not seen someone who is sick with coronavirus, we may start to think that this is something that is not lethal, or that is something that will not affect us. But it's a question of just numbers. If you follow what happened in Italy, Spain, France, and what is happening in Brazil now, at some point in time, they also had 1 case. At some point in time, they also had 10 cases. At some point in time, they also had 20 cases. But as the numbers rise, the acceleration also increases. Now it's thousands. Here in the US, it's millions. And the deaths are approaching 100,000. So this is something that, I mean, our countrymen must understand that we do not need to relax. Let's take lessons and draw lessons from where we have seen this thing happening, and that is Europe, that is China, and now South America and Brazil. It is important that we even become more aggressive in terms of our prevention, in terms of our social distancing, in terms of our use of masks, because 1,000 cases in Zimbabwe, that can spell disaster. So shokoriri marvelous, but I think we need to do more in terms of really engaging our communities, nema leaders, our communities, and chief, and community health workers, to make people understand why it is important kuti tirambe tichishandisa nzira dzekupreventa for a much longer time.
So I guess Marvelous will wish for you to say that in Shona as well, just briefly, 30 seconds. Go ahead.
Okay, so zvakakosha kuti ticherechedze kuti nyangwe tichiri pa 51 cases seZimbabwe, macases anokwanisa kuzomultiplya zvakanyanya sezvataona zviri kuitika kune dzimwe nyika dzakaita sana Brazil, Italy, Spain, UK kana USA. So sevanhu vemuZimbabwe ngatitorei zvidzidzo izvozvo tikwanise kuramba tichiita zve-social distancing, kugeza maoko, kushandisa mamask, tisakwanise kuzofamba same road iri kufambwa nedzimwe nyika like zvaakuitika kuSouth Africa izvozvo izvi.
Thank you so much, and hold on there, Doctor. I'm bringing in Marvelous, and maybe she can cross over to her sister, Lucy Chukwero. Go ahead, Marvelous.
Very interesting there indeed, Gibbs, because I think, I wanted really him to address that situation where people are saying they have not seen anybody.
Okay,
with the virus.
let me bring him back so that he can actually explain that. So, Doctor, people are saying they haven't seen any of this virus, and so people are just relaxed and all those kind of things. Can you react to that specifically? Just 1 minute.
Yeah, so izvi zvinoda kuti inini personally being here kuno kuAmerica ndaona zvakawanda in terms of the numbers, in terms of nyaya dzekumahospital, nyaya dzetesting. So hongu muZimbabwe unokwanisa because kune 51 cases, muZimbabwe mune vanhu 15-16 million, saka unokwanisa kunge usati wasangana nemunhu arwara nechirwere ichi. Asi makesi aya paachawedzera kana tikasaita zvekutevedza zvekuzvidzivirira, paanozosvika 1000 kana 10,000, makesi aya akusvikawo nepauri. So ngatinzwisisei kuti chirwere ichi chiri very contagious. So manumbers akangoraiza chete, it can easily affect a lot of people. Saka zvekuti hatisati taona munhu, ngatimbongotarisai zviri kuitika muTV, CNN, BBC, tozvibhilivha izvozvo and tizvidzivirire kuti zvisaitike kuZimbabwe.
So you can put that in English as well, concerning these fears that people are now too relaxed,
Okay, so this is not the time for us to let our guard down. If we closely follow what is happening in South Africa, the way the cases have accelerated over the last week, despite the measures that have been put in place, I think South Africa is really doing a lot in terms of trying to put in lockdown restrictions, everything else. But despite that, cases are rising. And once the cases accelerate and reach a certain number, say for example 1,000 arbitrarily, the increases become, even higher, because now those people can spread to many, much more other people. So the fact that we have not seen maybe a relative or a friend who has had coronavirus in Zimbabwe at the moment is because the cases are still low. But if we relax, and then our cases increase, say to 5,000 or 10,000, we can easily get to 1 million cases in a very short space of time. And this is what happened here in the US. You reflect back to something like 9-10 March, the cases were just a few. But a month later, around 10 April, the cases had already, risen, way above 500,000 and now approaching 1.5 million. So let's not let our guard down. Let's be even more aggressive, because we can draw lessons from our neighbors, from the US, from Italy, Spain, Brazil.
Thank you, Doctor. Hold on there. Let me bring back Marvelous, and maybe we can cross over to...
I think, that's a clear message right there, Gibbs, because for me, I really wanted that message to be, put out there to say, don't loosen your guard, because I've seen a lot of people have been talking about the lack of food, especially. That is what is driving most people to go out there to break these lockdown rules, because they are saying they don't have any food in the house. I don't know, maybe if you can ask the doctor also to address that issue in regards to food and the coronavirus.
Yeah, okay, so we'll go back to him in some few minutes, but let's cross over to Ndimande. But before we talk to Ndimande, let's play a video of a lady who is based in Botswana. She's talking about some of these issues, food and so forth. Let's listen to what she is saying.
Salwanani basakazi bestudio 7 linjani lapha elikhona baba Dube lo baba Sibanda Ezra Chisa Sibanda. Siyabonga kakhulu baba Ezra Chisa, wenza umsebenzi omkhulu wesizweni sakoMthakazi. Siyawubongisa sibili, siyawukhulela ingani uNkulunkulu ngakuphindezela amanye amalanga okuphila emhlabeni. Hayi mina igama lami ngiPretty wakoNcube. Ngokuhlala ngihlala eBotswana ngokuzalwa ngizalwa eLupane. Hey mina into engizwe ubuhlungu ngendawo yakithi eZimbabwe. Sizobuhlungu sithi nxa sizokuthiwa kulabantu abalokho besatshaywa ngalezi insuku zanamuhla betshayela ukuthi abazi ulimi. Hey siyazibuza ukuthi kanti pho sathi yebo sizwile ngeGugurawundi babaqeda aMandebele lakathesi lokho kusesenjalo phela kusho ukuthi vele iGugurawundi ayikapheli lakathesi lokho sesekhona. Sokuchiyeni ukwenza nje kuphela kodwa usho ukuthi lokho sesekhona. Hayi kunzima. Siyabonga sibonga kakhulu silamagqwetha amela abantu besifazane ngoba hey abantu besifazane ezigabeni semathebeleni bahlukuluzwa sibili indaba le yamapholisa le ayimnandi nami umuntu wesifazane. So nxa ngibona uhlukuluzwa umuntu wesifazane onjengami lami ngiyabenza.
So marvelous. This lady is Pretty Ncube. She's based in Botswana. So she's really worried about some incidents of the intimidation and harassment and the beating up of women in Zimbabwe. So she's referring particularly to this incident in Bulawayo, in which some 2 women were allegedly beaten by the police while they were looking for food. And this is one of the most important things in Zimbabwe during the lockdown period. So they are saying that, she's saying that it's not good to beat up women. It's not good to beat up anybody during the coronavirus lockdowns. So maybe before I come to you, let's go back to Mr. Ndimande. Mr. Ndimande, this is a very topical issue in Zimbabwe right now as we speak, because there are some other women like Joanna Mamombe and others were actually abducted and beaten up allegedly by people said to be linked to the state. So kuhamba njani nxa sisikhuluma ngodaba lolu ngamafitshane sibili ngobuhlelo solubuye emaphethelweni briefly khonapho Ndimande.
Ya mbona ngani kule problem lapha sibili ikakhulukazi ihlangothi lukahulumeni.
Gibbs, I'm not sure because I can't really hear you, but anyway.
In other words, ngoba ukuhlukulezwa kwabomama okunje ugovernment atholelezi engana kwenzakalanga lutho. Singasakwazi ukuthi indaba le ngoba ama-pressure groups amaningi bathi ngani le tribalism phakathi amapholisa lawa. Really at this age we don't believe ukuthi kumele kube le ndaba le tribalism esihlupha kangaka. Ngikhondene futhi indaba le yenzakala kweHarare ama-politically ama-problems lawo omama laba abanaywayo lawa. Ngithi i-wrong into le government yethu if really ifuna ukufaka i-face e-right kuma-investors outside bayenze kahle.
Yes, siyawuzwa kakhulu Ndimande, siyabonga kakhulu mfowethu. So what Ndimande is saying is that it's not good to actually beat up people. He's saying this must come to an end. So now over to you, Marvelous. Maybe we are remaining with about 10 minutes. So maybe we cross over to the doctor or Mrs. Chikowero. So let's just do it briefly. Go ahead.
Gibbs, I will just reiterate, the current number. Right now in Zimbabwe, we have 51 cases of positive cases in Zimbabwe. Saka parizvino munyika tine vanhu 51 vabatwa nechirwere ichochi cheCovid-19 kana kuti coronavirus. Tine vanhu 4 vawanikwa ivo vachishaya, uyezve vanhu 18 vawanikwa ivo vachibata chirwere ichi asi vachikwanisa kunge vachichirwisa. Saka tanga tiri kuziva ipo pano tiine chiremba vanga vari pano Dr. Admojo Kwiro vachiedza kutaurira vanhu kuti aiwa kunyange usati waziva munhu awanikwa iye achibatwa nechirwere ichi checoronavirus, zvakakosha kuti muongorore zviri kuitika imo muno muAmerica umo pari zvino maane vanhu vakawanda chaizvo vawanikwa vachibatwa nechirwere ichi. Muchitarisa zvakaitika kuItaly, kuSpain nekuBrazil ndo nyika dzavataura. vachitaura ivo kuti zvakakosha kuti muongorere zviri kuitika pazvivhitivhiti muchitarisa imi mafambiro anoita chirwere ichi, kuti unogona kunge usina kuona munhu anacho, asi kana chauya chinobva chauya chichitora vanhu vakawanda. Saka zvakakosha kuti vanhu muenderere mberi muchipfeka mamask, social distancing, uyezve kana uchikwanisa kugara mumba, gara mumba, geza maoko, kunyange hazvo tichiziva kuti kunzvimbo dzakawanda kune dambudziko remvura. Gibbs.
Yes, we still have got our guest, Agmo Chokwiro, that is our doctor, and Lucy Ndongwe Chikowero. So can you pose a question to one of them, and then because the program is coming to an end. Quiet, Marvelous. So I think we've got a breakdown in terms of Marvelous is not getting me clearly there. So now, doctor, so what's the way forward for Zimbabwe? We see that there are all these problems. So can we conclude now, wrap it up? What should Zimbabweans do right now?
I think, firstly, I would like to thank you for the work that you are doing to get the right the message right to people. I think we need to continue to do this because we need to remind each other where things are going. We need to base our decisions according to science, according to developments, according to any new information. So as broadcasters, I think it's important that you continue to do the work that you are doing, and I appreciate it so much. To my colleagues, my countrymen in Zimbabwe, I think it's important that we reflect on with the first case that was reported on the 20th of March. What happened in those first few days is the losses of lives that we had, and may their souls rest in peace. It's important that we interpret that as we go forward, the cases are rising. Our colleagues are coming back from countries where they could be hotspots for coronavirus. But how do we protect ourselves? Those people that are coming back into Zimbabwe and those people that are already in Zimbabwe, let's use face masks. Let's ensure that we wash our hands all the time. Let's avoid touching our faces, our mouth, our nose, our eyes. Let's ensure that we can social distance where we can. The government must also continue to come in big in terms of making facilities safe, in terms of ensuring that there's enough protective, personal protective equipment in the hospitals, and ensuring that our staff are well trained, our staff are provided for. I think those are the things that we need to continue doing, and then let's engage our communities. The issue about food, the issue about traveling, the issue about working, for sure we cannot be able to sustain our economy when people are not working. That is important. But let's work in safe environments. And us as individuals, each and every one Zimbabwean, let it be our responsibility to ensure that we are safe, our families are safe, and our colleagues and friends are safe. So I think we still have a long way to go. We cannot let our guard down because we just have 51 cases when our neighbor South Africa have over 19,000 cases now. That is a sign, and that is important. Mozambique also has cases, Zambia also has cases, Botswana also has cases. So that is a sign that if we are doing something right, let's continue to do the things that we are doing right now. Gibbs.
Thank you very much, Doctor. Let's bring in our other guest, and that is Lucy Chikowero. So, Ms. Chikowero, as far as you are concerned, so do you think that Zimbabwe should follow the example of USA in terms of addressing this COVID-19? 1 minute, then we'll wrap it up.
Yes, I absolutely think Zimbabwe should step up on testing and contact tracing, because that will give us a true reflection of where we are really at. Because I feel like there's something that is really lacking there. That's number one. Number two, I also like our government to ensure social protections of individuals. You can see that in the United States, the government resolved to give mass stimulus packages to families. So we need to do that because people cannot exercise social distancing when they are hungry, because there is immediate danger of hunger in their homes. So the COVID issue that they cannot really see or feel at that particular time it will not be an immediate threat to them, while it is actually a threat that can wipe out the whole country. So our governments need to step up on social protections, access to food and so forth. And also, finally, I would like to say we need to see an end to violence against women. We cannot talk about end to domestic violence, gender-based violence, when we are not talking about institutional violence that is being perpetrated on individuals. So we also, there is need to step up, and I'm actually calling upon our president to particularly come out and address this particular issue in regard to young women. Our differences politically or ideologically shouldn't result in violence against each other. We are all Zimbabweans, so we need to protect each other and end violence.
Thank you so much. We wish to thank Lucy Ndongwe Chikowero, and I'll take this other opportunity to thank Dr. Atmo Chokwiro and our other guest, that is Mr. Fundani Ndimande, who is in Lopengola West in Bulawayo. I think my co-host will come here right now and we'll wrap it up. So signing off is Gibbs Dube in Maryland.
Yes, Gibbs.
Yes. Yeah.
Gibbs, thank you so much. An interesting call there from our sister, for the end of violence, because we understand that during this COVID lockdown, there's been high incidence of domestic violence and institutional violence, like she's saying. And also thank you to Dr. Admojo Kwiro, who's out in Atlanta, Georgia, but is really based in Nyanga, back in Zimbabwe, for giving us his insight into this corona pandemic and what we're seeing happening on the ground, Gibbs.
So our time is up, Marvelous. This is Gibbs Dube in Maryland. So you can sign off there. Go ahead, Marvelous. Sorry,
Marvelous.